So I think that really we're beginning to develop, or at least this is a standard treatment. We're going to look at newer treatments in this particular setting, and I think that this is actually a fairly bright future as far as clinical trial investigation is concerned for this disease. But remember, we must try to look at the multidisciplinary approach in this tumor type because of the fact that only about 11% of patients receive a cisplatin-based chemotherapy prior to surgery, and that's I think a big concern from all of us. Dean, any comments?
Yeah, and actually, one of the issues that I think has been raised in some of our meetings, the Bladder Cancer Advocacy Network, for example, has a think tank every year, and a number of patient advocates spoke up and said, if I have muscle-invasive disease, I would at least like to have the conversation, a multidisciplinary conversation with both the surgeon and the medical oncologist, similar to a woman with breast cancer, that it's really team-based. I think that would go a long way in terms of at least providing to the patient a perspective of both aspects of treatment.
Agreed. I think that approach is the optimal one. In fact, thinking back historically with the SWOG trial, one of the problems we did have initially in accrual, I mean, the accrual was very, very poor at the beginning. And in fact, I think the NCI nearly shut that study. But we actually came up with a patient-based videotape that explained the process of chemotherapy. And I think that the patient then begins to understand that and accepted what the concept of the trial was. But I think that it does need to be presented to the patient in a balanced fashion, side effects versus what the overall benefit's going to be, and certainly the issue of survival improvement. So,
yeah, I think a lot of this is awareness. I mean, if you look at the studies in regards to neoadjuvant and perioperative chemotherapy use, if you look at studies that were published back in early 2000s, it might have been in the 5% range. Well, much of this data didn't come out until the early 2000s.
Exactly.
But if you're starting to look forward now, as you mentioned, depending upon which study you look at, it might be in the 10 to 30% range use of neoadjuvant chemotherapy. At our center, because we have a multidisciplinary clinic, it's a little bit over 50% use. And the ones that we looked at the reasons why patients weren't receiving it, usually it's from comorbidities, et cetera. But that being said, then a lot of this is just time, education, awareness, et cetera. And I think that the multidisciplinary clinics, at least at academic centers, really help out. I mean, the urologists are really on board. They believe in it. And I think that's a key component. It's just if the urologists don't believe in it, then medical oncologists will never see the patient for neoadjuvant chemotherapy.
Exactly, or at least a venue that this could be discussed, such as tumor boards, or for my instance, my office is in the urology department, so it works out perfectly. We have a lot of cross-fertilization in that particular way. So I think that again, when you look at prostate cancer and some data that came out of Jefferson from Dr. Gamella's group, where they looked at the multidisciplinary approach, they did seem to have an overall better outcome stage for their patients when this discussion was ensued. So I think that this is something that I think needs to be quantitated in bladder cancer in some fashion, whether this is through the SEER database or some other way. But I think that outcomes, particularly as we're talking about the future with managed care and bundled payments and all these other things, outcomes are going to be important because we're going to be judged on that for our patients.
Well, if everybody's invested,
that's right.
it works.
That's right.
And we just looked at our data in over 150 patients, and after neoadjuvant chemotherapy, the median time from the end of chemotherapy to the time of the cystectomy was 34 days. As long as you've integrated it, the urologist is seeing them at the very end of chemotherapy right along with you. You're just passing the baton.
Exactly.